Everyone, please rise and join me for our invocation with Chaplain Johnson.
Our heads. Dear Heavenly Father, we come together today for the work of the Sarasota Memorial Hospital healthcare system. We are ever mindful of chaos in the world. I'm grateful that we can work to make this world and the lives of those here be in a better place because of the care they receive. May everyone here feel strength and support as they go about the work they are about to do. May your love and support touch everyone. I ask this in the name of the Lord. Amen.
Amen. Join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, indivisible, with liberty and justice for all.
Before you leave, I want to shake your hand. Good one.
I'd like to call to order the Sarasota County Public Hospital Board meeting. I have a statement to read that any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. Citizen comment pertains to an item on the agenda today. The comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to speak to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and the legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. We'll start with the approval of the orders of the day.
So move.
Do we have a second?
Second.
We have a motion and a second. All those in favor, please indicate by saying yes.
Yes.
Opposed? The orders are approved. Then we'll go to the minutes of the meeting of July 18th. Approval of those minutes.
So move.
Second.
Motion and a second. If there are no questions, all those in favor of the motion, please indicate by saying yes.
Yes.
The meeting minutes are approved. Thank you. I see we have no board reports, so we'll move to our presentation. Dr. Hammond, if you would introduce our speaker, please.
Yes, thank you. Dr. Carroll was unable to be with us today. He sends his apologies. In his place, we have the very well-known Mary O'Connor. She's our childbirth educator and is going to give us a great presentation.
Thank you so much. There's a large body of evidence right now, and it's growing every day, that says that there are significant health benefits for babies who breastfeed and for the mothers who breastfeed them. There's breastfeeding is a natural conclusion to pregnancy, and women who choose to breastfeed under normal circumstances who are giving the correct support can usually successfully achieve their goals. So looking at the health benefits that we know that are out there to breastfeeding right now, look at the first one just for example, lower respiratory tract disease and hospitalization for 72% less with exclusive breastfeeding greater than 4 months. So the timing of breastfeeding, the length of time that babies breastfeed, and the exclusive nature of that breastfeeding confers more health benefits as time goes on for the little ones. For example, obesity, 24% less with any breastfeeding. There's protection against diabetes type 1 and type 2. SIDS, which is a great concern to new parents, is 36% less with breastfeeding greater than 1 month. For our tiny babies in our NICU who are born prematurely, there are significant benefits to getting human milk in their diet. So our neonatologists in our NICU are big proponents of babies getting an exclusively human milk diet as far as possible. Babies in the NICU who are born less than 3 pounds, 4 ounces are at risk for a devastating bowel disease called necrotizing enterocolitis, and that can result in death of a newborn. But the risk of that can be brought down by 83% for babies who receive an entirely human milk diet. So you can see that there are many, many advantages for babies who are breastfed. The advantages don't stop there, though. Mothers who breastfeed their babies have significant health benefits themselves. They have reduced rates of rheumatoid arthritis, obesity, and cardiovascular disease. In addition, there are reduced rates of breast cancer and ovarian cancer for mothers who breastfeed. So you can see that Mother Nature, through breastfeeding, is protecting the mother and protecting the baby. So what we want to examine is what is our role as a hospital and what we're doing to try and help promote and support mothers who are breastfeeding. So the World Health Organization and UNICEF, back in the 1990s, started a program called the Baby Friendly Hospital Initiative. And what they wanted to do through this hospital designation is recognize hospitals that were implementing the latest evidence-based practices that support and promote breastfeeding. So the program ensures that mothers get the correct information to start breastfeeding and continue breastfeeding. The Baby Friendly Hospital Initiative tenets are the 10 steps to successful breastfeeding. And these 10 steps are evidence-based practices that are shown that when hospitals employ these practices, mothers are more successful. The 10 steps to successful breastfeeding are supported and endorsed by the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the American Academy of Family Physicians. You can see all of them there that are supporting the 10 steps. So here are the 10 steps. Actually, when you look at the practice and guidelines for the Baby Friendly Hospital Initiative, each one of these 10 steps open up into a very large number of practice components. But basically, in a nutshell, the first one is most important, where we have a standard practice policy that all team members in the hospital, both physicians and nurses, follow, so that we make sure that we're all on the same page in regard to how to properly manage and support a mom who is choosing to breastfeed. And the second one I've highlighted here is train all healthcare staff on how to implement this policy. So this is where, on the next slide, you'll see we've got a lot of traction in our initiatives when we actually got our bedside nurses trained in how to fully support mothers, and then also in our physicians and getting us all on the same page with the latest evidence on how to properly support mothers. So this is a graph of our outcome measure, which is exclusive breastfeeding of the term baby at discharge from mother-baby unit. These two items were initially added by the Joint Commission as a core measure for reporting in the January of 2014. We began looking at this measure back in 2009 because we understood that it was an important outcome measure to follow our success in our lactation program. At the end of 2009, quarter 4, was when the director of the Women's and Children's Division, Pam Beitlich, recognized that we needed to work on our lactation service and implement practices in the hospital that would better support mothers. So at that time, we looked backwards to get our baseline. So those figures that you see from quarter 1 to quarter 4 of 2009 was before our interventions of the 10 steps. We started employing those tenets of the Baby Friendly Hospital Initiative during these years. That top blue line means term babies who are discharged from mother-baby unit exclusively breastfeeding. And that blue line is the mothers who chose breastfeeding. So when mothers come into the hospital, they say, I want to breastfeed. In 2009, only about 46% of those mothers were going home exclusively breastfeeding. And we know from the health benefits now that there are significant advantages to exclusively breastfeeding. So what we've done over time is we've changed our model. We put an emphasis on having the bedside nurse educated and validated on skills that they can fully support the mother 24/7 during her stay here in the hospital. And you see we got a lot of traction through that. So therefore, the mother is at 2 a.m. in the morning when she needs help with breastfeeding, we have an expert lactation nurse who is her bedside nurse helping her through those moments. We employed another one of the 10 steps to successful breastfeeding the third quarter of 2012, we worked on rooming in, which is where babies routinely stay with their mothers. Hospitals historically had separated babes and moms in the past, and that was for reasons we thought that babies were safer and it was more sterile environment to keep a baby in a nursery. But now we know that the evidence is very different, that moms and babies need to stay in close proximity. So we employ that regularly now in our mother-baby unit. We moved into the new tower in the end of 2013. The space is fantastic. Nurses love the new tower, and all the patients love the new tower. We did see in retrospect that we had a slight dip in our exclusive breastfeeding rates, and I believe that was just as we adjusted to our new environment. But we did rally again. In the beginning of 2015, we worked on getting the latest evidence for our hypoglycemia policy, and that's how physicians and staff manage the babies who are born at risk for low blood sugar. So by implementing the latest practice guidelines for hypoglycemia, we were able to better support moms who are choosing to breastfeed. This time last year, David Verinder signed the application for us to formally move into the baby-friendly hospital initiative. At the same time, he also signed the Empower Breastfeeding Initiative, which is a CDC-funded program that's helping 100 hospitals across the country become baby-friendly, and that's a $6 million CDC project. So with both of those, accepted into both of those last year, we started to really drill down on the 10 steps of successful breastfeeding. And you see we got a bump in our rates to 79% per quarter for those moms who are choosing breastfeeding. And then most recently, the last quarter, we've been working hard on physician education and making sure that all our providers have the latest up-to-date information about supporting breastfeeding. And we've got a recent bump again in our exclusive breastfeeding rates. So you can see from quarter 1 of 2009 through quarter 2 of 2016, we've had an 83% increase in exclusive breastfeeding rate of the term baby at discharge. So we're going to continue to work on our initiatives in mother, baby, and labor and delivery and throughout the hospital and move towards closer to designation in the not-too-distant future. Thank you.
Any questions for Mary?
Thank you.
Thank you very much.
Thank you.
Excellent report. Thank you.
She had it all thing pretty much memorized.
Next, we'll have our Excel Award winner for July, David.
Thank you, Mr. Carter. Natasha Snipes, can you come join me? So I am happy to introduce you to the board and the board to you. Natasha Snipes is our Excel recipient for July. She is a Health Information Management Specialist in the HIM department and has been with Sarasota Memorial since June of 2004. The comments from her coworkers are pretty special. Natasha displays leadership in her job duties. She's our department go-to for questions. That's because she has all the answers. She is a strong, solid person who stands by her beliefs. She accepts people for who they are. Her style is to never criticize, but to offer encouragement and positivity. She's a hardworking single mom who takes on extra projects and overtime when possible to provide for her family. She does it all with a smile and grateful attitude. That said, she still manages to contribute to Mothers Helping Mothers. She participates in Relay for Life and is a volunteer cheerleading coach for youth football. I don't think anyone could sum up better than her coworkers when they say she is a beautiful example of paying it forward. Thank you for everything you do. We appreciate it.
Thank you.
You can do it. I heard you before. You did it great.
I'm just honored to receive this award, and I'd like to thank my great management, Kiva and Teresa. I just love working at Sarasota Memorial Hospital.
We love having you. So, going back, I want to read a plaque to you, okay? So I read this to you at Management Council, and then I told you I had to take it back from you.
Yeah.
Right? Okay, so now you get to keep it, okay?
Okay.
All right. So Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care to our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes Natasha Snipes with the Excel Award for the month of July 2016, signed by myself and Mr. Carter as chair of the board.
All right.
Thank you very much. Okay, if I continue, Mr. Chair?
Go right ahead, David.
Okay, so I'd like to ask Susanna Willis Cunningham to come up with me next. Here, I'm right with you, though. So, Susanna Willis Cunningham is our Excel recipient for August. She's a room attendant in environmental services and has been a Sarasota Memorial employee since 2006. Her coworkers describe her as bright, kind and sweet, cheerful and positive, and always a team player. They go on to say she's a real asset to 10 Waldemere Tower. Our rooms are always in great shape when Susanna is working. She's efficient, fast, thorough, and extremely dependable. She's also known for going beyond her job duties. One of the ways she does that, her team says, is by taking the time to talk with and assist our Spanish-speaking patients and families, which can be especially comforting and reassuring. Her coworkers say she's like a breath of fresh air. We think the Spanish-speaking patients and families that you would help would also agree. So thank you for everything, and we so much appreciate you being here. We also love to hear from you online.
No
Okay.
problem. Okay, my name is Susanna Willis Cunningham. I've been here working for 10 years, and I love my job, what I'm doing. So this award, I just want to share with all my co-workers, with my supervisor, leads, everybody, and with all the 10 Waldemere staff. They got a great team. Cindy got a good, hard worker team. 10 Waldemere is not easy floor. It's very busy floor. But with the good team, make the job easier for everybody. We are here for our patients. Everybody put, a little bit love, care. That's make, big difference. And one happy face make a big difference to everybody. So thank you to all. Thank you for everything.
No, I wasn't nervous at all, all right?
A little bit.
So let me, if I can, I took this back from you at Management Council too, but you get to keep it today, all right?
Okay.
So let me read our plaque to you. Our Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes Susanna Willis Cunningham with the Excel Award for the month of August 2016. Thank you for your continued dedication and excellence. It's signed by myself and Mr. Carter's board chair.
Thank you very much.
Thank you so much.
She cheered me up.
You would like me to go on?
Please.
Okay. Mark Campbell, can we have you join us? That's good, always to have you. All right. So, Mark Campbell is our Hero Award winner for August. He is a clinical coordinator for 5 East Tower. After attending a patient experience conference at the Cleveland Clinic, Mark was catching his return flight to Sarasota. He was seated at the back of the plane when he saw a flight attendant walk up the aisle from behind him, coughing and leaning forward. The cough didn't sound good, so he immediately asked if she was okay. She was clutching her throat, which is, of course, a universal sign of choking. Mark calmly told her that he knew the Heimlich maneuver, and in performing the Heimlich, he was able to dislodge the obstruction for the flight attendant. She was okay, and in fact, she was able to continue with her responsibilities, so the flight wasn't delayed. So here's a question. Do you think anyone else would have known what to do in time? So we thank you, Mark, for knowing just what to do. Your quick thinking actions were life-saving and heroic, and we think the flight attendant would agree. So congratulations.
Thank you so much.
That's okay. Well, thanks for inviting me here. I appreciate the recognition. I guess goes back to your question if anybody else would have recognized what to do. And so I don't know if I consider myself a hero or being at the right place at the right time and knowing what to do, but it happened nonetheless. Fortunately, I was really in a hurry to get back home to see my family, and our flight wasn't delayed, so that was my main thing. It's also kind of just wanted to touch real briefly on the result of this. It's not really in there, but I kind of felt like I was putting myself in a little bit of danger, thinking about being on the airplane, in the very back of an airplane, and having a stewardess bent over in front of you and doing a Heimlich maneuver on her, and nobody else on the plane recognizing what's going on other than they see a stewardess that's in distress and a big guy behind her. So as the flight crew's kind of approaching kind of rapidly, and they fortunately realized what was going on, it was kind of, I felt like a little relief myself that nothing pursued from that, and she was able to take that breath, and we were able to go along. But I just wanted to share that. But thanks for having me.
Yeah, that could have, we could have been reading about a different story in the paper. I didn't think of that. So, anyway, let me read our plaque to you. So, a Hero Hall of Fame, hospital board and administrative staff of Sarasota Memorial Healthcare System hereby induct Mark Campbell into the Team SMH Hero Hall of Fame for actions that capture the essence of a true hero, including courage to have the persistency in the face of fear, passion to always do the right thing,
Something's wrong.
integrity to have a strong moral compass, concern to have the concern for the well-being of others.
Right.
Signed by myself, Carter, and Portia. Congratulations. We'll give it to you. All right, we'll go ahead. Thank you.
Congratulations.
Okay, Mr. Chair.
One more,
Okay.
David, please.
And you're going to kick me off the stage, huh?
I didn't say that.
All right. So I'm going to invite Jean. All right. So Jean Lucas is our leader for the third quarter of 2000. Recently, the role of associate chief with Sarasota Memorial since January 2007. Many accomplishments. Jean's many accomplishments set the example for high-quality leadership skills. In addition to her ACNO position, Jean has led the charge for us to become a trauma center. She recently served as an advisor for the Career Ladder and was also elected president of the Suncoast Organization of Nurse Executives for Sarasota County, or SCONE. That's how I would say that, right? SCONE. All while earning her PhD and earning her certification as an advanced nurse executive. Jean's peers describe her as supportive, innovative, compassionate, and kind. She puts programs and process together to benefit the organization. She encourages her management team to strive for excellence. Jean is simply a visionary. In summary, her peers say Jean's compassion, empathy, and kindness for patients, staff, and peers are unmatched. And she carries this passion beyond the walls of Sarasota Memorial Healthcare System and into the community. So before I tell you thank you for everybody, I'm going to just say it on my own behalf. I went to Jean about a year and a half ago and asked her, or maybe it was 2 years ago, I'm losing count. Was it two? Was it two, you think? It was 2 years ago. And said, how would you like a new challenge? And she said yes before she heard what the question was. And I said, we really need somebody to spearhead the trauma program and get that going in Sarasota County and for this hospital. And it was a monumental task. It was one that we all had our doubts sometimes. Jean never did. I did sometimes. But it was your perseverance that got us through that. And so we all, as a community, as a hospital, and the board, all thank you so much for what you did. Thank you.
just want to say thank you for this, of course, and thank you for the opportunity to make Sarasota Memorial the first trauma center in Sarasota County. It's really historical, and it was a pleasure to be a part of, and certainly it's nice to get some accolades, but seriously, I mean, it took this whole organization and community and was really just amazing. And I think, that's just a simple example of why it's such a privilege for me to come here every single day, to come to work, because of the amazing work this organization does, the talented individuals that are a part of this organization, all the employees. And it's, I appreciate the award, but that award is really a reflection of all the amazing people, the teams that I get to work with every day, and the work that they do. So, thanks.
That all's true, but it takes a leader to stand up and lead the group, so thank you for everything. So we have a plaque to give you today. It's our Leadership Award. Simply, if your actions inspire others to dream more, learn more, do more, and become more, you are a leader. The hospital board and administrative staff of Sarasota Memorial Healthcare System present Jean Lucas with the Leadership Award for the third quarter of 2016, with thanks for your continued dedication to excellence, signed by myself and also Mr. Carter as board chair. Thank you.
Okay, we'll move now to our report of the medical staff from our Chief of Staff, Dr. Hamad.
Thank you. First, we would ask for approval of the revised cardiac thoracic surgery privileges forms.
I move approval of the revised cardiac thoracic surgery delineation of privileges as recommended by the Medical Executive Committee.
We have a motion and a second. Any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much.
Okay, that is the end of my report.
Thank you, Doctor. Next, we have our auxiliary report from the auxiliary president, Ed Miller.
Thank you, Mr. Chairman. I have 3 events on which to report. The first is that August brings the return of the start of the high school calendar this year. We will have our Sarasota County Teenage Volunteers, TAVs, returning to their schools on August the 22nd. And Manatee County TAVs, they've already been in school since August the 10th. They are very instrumental in providing service to patient discharge, courtyard tower desk, gift shop, and the clinical research center. We do appreciate having these young people in our hospital. Second, the auxiliary also provides support to the employees through 2 uniform sales each year. This is a very popular event for 2 reasons. It allows employees to purchase their uniforms in-house without having to go to a mall or an outside source. We also have the means to provide payroll deduction for up to 3 pay periods, pardon me, which allows the impact of the purchase to be spread out over time at no added cost. We will be having our final uniform sale of the year on Tuesday and Wednesday, tomorrow and the next day, of this week in rooms 4A and 4B, adjacent to the cafeteria. And last but not least, the patient discharge volunteers were invited to a celebration and cake event on Friday, last Friday the 12th. This event celebrated the support of the volunteers in the discharge initiatives of the Capacity Management Program. Mr. Chairman, that concludes my report. Thank you.
Thank you, Ed, very much. We have our Secretary's report, Mr. Bob Strasser.
Thank you, Mr. Chairman. There are a number of things both in August and September, so please bear with me. The first is August the 19th, Friday, at 10:30 to 11:30. There'll be a rehab pavilion topping out ceremony at the rehab construction site. The next meeting in August is Wednesday, the 24th, 8 to 11, the budget retreat, Papaya Room, very important. Moving to September, first meeting is Tuesday the 6th, number of committee meetings from 8 until 12, and very important, the first tax hearing at 5:01 on Tuesday the 6th. On Saturday the 10th, 7:30 to 10:30, the SMH Heart Walk in Benderson Park. The last meeting that I'm on the board is Monday, September the 19th. Again, the corporate board meeting, and again, that evening, 5:01 p.m., the second and final tax hearing. Thank you, Mr. Chairman.
Thank you, Bob. Treasurer's report today with Darrell Henry.
Thank you, Mr. Chairman. I move approval of the bad debts and charity care for the month ended July 31st, 2016, in the amount of $15,753,000.
Second.
We have a motion and a second. Any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
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 Opposed? Motion passes. Thank you. Next, we have the operations report. Our Chief Financial Officer.
Thank you, Mr. Chairman. I have the financial highlights for July. And for operating revenue for the system for July, we had operating revenue of $61,150,000 compared to a budget of $50,798,000. Fiscal year to date, and this represents 10 months of financial activity, operating revenue of $593,770,000 compared to a budget of $553,088,000. For total expenses for the system for July, actual $52,882,000 compared to a budget of $52,614,000. Through 10 months of this fiscal year, $565,736,000 compared to a budget of $547,611,000. Our operating income for the system for the month of July, $11,022,000, and that generated an operating margin of 16.9%. And this compares favorably to a budget of $972,000, which was an operating margin in the budget of 1.8%. Fiscal year to date, operating income of $56,054,000, which generates an operating margin of 8.9%. And this compares favorably to a budget of $32,955,000. We budgeted an operating margin through 10 months of 5.6%. Looking at statistics, and these are for the hospital through 10 months, average daily occupancy, 478 patients per day, compared to a budget of 440. The average length of stay is 4.64 compared to last year's 4.76 days. Admissions through 10 months, we have 26,782 compared to a budget of 23,013. The hospital surgery cases through 10 months, 17,807 compared to a budget of 17,088. We've had 2,872 births compared to a budget of 2,785. Outpatient registrations through 10 months, 353,447 compared to a budget of 364,191. And registrations in our emergency care centers, 104,774 compared to a budget of 93,436. And for our case mix index, again through 10 months, for all patients 1.86 and for Medicare patients 1.97. Mr. Chairman, that concludes my report unless there's any questions.
Okay, thank you, Bill, very much. Now we have the operations report from our Chief Nursing Officer, Jan Mock.
Good afternoon. Last month, I had mentioned that we were opening a specific trauma unit, and I'm happy to report, and you can see the picture here of the team that's been pulled together. A wonderful team. and it opened on August the 2nd. It's on 7A of East Tower. And I want to thank Catalina Jekanowski and Brad Thompson, who are the leaders that put this team together, along with Dr. Brockhurst. And so they've been full since they've been opened, and I think it adds that next step to our wonderful trauma program. I'd like now just to give you, as I do frequently every couple years, an update on our magnet. As we all know, we are a magnet facility, and in October, we will be sponsoring the National Magnet Conference, which is in Orlando, and it's being co-hosted by the magnet facilities within Florida. So we will be co-hosts, and there's be attending about 10,000 people attend this conference, so you can see the magnitude of the impact that it has. And it's both for magnet hospitals and those who are on their journey to become a magnet hospital, both from the USA and across the globe. Some of the highlights as a sponsor, the CEO and the CNO will be highlighted. That'd be David and Connie at the opening session. We will be recognized, and we, as a sponsor, we have offered 170 hours of volunteers throughout the conference, so a lot of coordination going on. Jen Reingans, Dr. Jen Reingans has been awarded a podium session, which is very prestigious and very hard to get, on her research that she did at Sarasota Memorial. The research focused on developing coping skills by building resilience for nurses to thrive in their challenging work that they do every day, and to avoid compassion fatigue, which I'm sure we've all heard about. The results were very positive, and they're very excited about her representing us, and she will do it very well. We presently are working on our 4th magnet designation, which will be due in February of 2018. The magnet team is currently writing all the exemplars as we speak, and we have many to write about. There are only 26 hospitals in the United States that are either 4th designated, which is, as we always know, we were the 1% with 3rd designation. This is a 0.5% of hospitals that get the 4th designation. So we go, when we receive this, we'll go from the 1% club to the 0.5% club. And I just want to thank the board, the senior leadership team, and the entire hospital for their support and us being a magnet designated hospital. It couldn't be done without the leadership and the entire organization. Just a little history. The magnet program started in 1980 when there was a nursing shortage, and we are now again in the 2000s of having another nursing shortage. And they wondered why certain hospitals had better recruitment and retention of nurses and better outcomes. So they studied that. They studied 165 hospitals. And from that, they saw the components that make a magnet organization. So they found 41 hospitals with those standards, and in 1990, they started the Magnet Hospital Recognition Program. And some of the other hospitals that you're well aware of that are in the same area that we are at being magnet are Johns Hopkins, Mayo Clinic, Cleveland Clinic, Mass General, Duke, Stanford, Vanderbilt, and many others. We became magnet designated in 2003 with our first, 2008 with our second, and 2014 with our third. And the timeline between those is 4 years. So I think what holds true as we look at the nurses that I talk to in nursing orientation every 2 weeks is most of them are aware we're a magnet organization, and those who have come from magnet organizations state they would only work in a magnet organization. So I think that research that's been done holds true today. And so I just want to thank you all for your support and let the community know a little bit about magnet, and we are well on our journey and in great shape, and I have no doubt we will have our 4th magnet designation. Thank you.
Thank you very much, Jan. Normally we would have our committee reports, but we had no committees that met in August on our August break. So we'll move to the President's report. Our President and CEO, David Verinder.
Oh, good. I passed the security alert, I suppose. Hey, Mr. Carter, this is my report for the month of July, and as always, I'd like to start with our report card for our year-to-date numbers through July of 2016. We start with our service pillar. We look at and in service, we look at our HCAP scores. We all know we have a goal of hitting 9 out of 11 in our HCAP domains at being 50th percentile or better. We are a little bit short of that right now. We're at 7 out of 11. We did improve slightly from last month when we actually had 6. So we feel good about some of the upcoming months as the results are coming in, but more to go, and I'll show you the details on that here in a minute. On the outpatient side, we have our number of domains at greater than 50%. Our goal is to be at 55 out of 58. I am happy to report we're at 56 out of 58, so beating goal, and once again, show you the details on that in just a minute. In the people pillar, the turnover of part-time and full-time employees that were hired within the last 12 months. We have a goal set out at being 34% or less on this line. I am happy to report that we are solidly beating that number at 30.98% and still making improvement on it. Just to remind the board, we started out above the 34% at the beginning of the year. In the quality pillar, our infection prevention indicator, which is our combined overall standardized infection rate, the national average being defined as a 1.0, our goal is being less than 0.95, and I'm happy to report we are exceeding that and coming in at 0.90, so excellent results there. Financial pillar, Bill Wojin, our CFO, has already reported on that. We have a goal or a budget of 5.2% margin, and our operational margin is currently projected at 8%. In the growth pillar, we have 2 indicators. One is our inpatient admits, including observation outpatients. We have a goal of hitting 35,301 for the year. We're on track to exceed that at 39,239. On the outpatient side of registrations, we have a goal of being at 747,000. We're a little bit below, projecting a little bit below that at 746.9, 900,000. So a little bit of work left to do there. So when we look at the HCAPS details, we see our 11 domains there on the left, and then we can see what the current national average is in that first column, the first numerical column, and then we see what our number is. And so you can tell in the green are indicators that we are exceeding right now, and in the red we have some work to do. So we are close on our communication with doctors, but we still have quite a bit of work to do on quietness in the hospital, responsiveness of staff, and cleanliness in the environment, although I will say we are improving with the scores we're seeing and have a lot of teams around these. When we look at our outpatient service lines domains, we are actually hitting 100% in everything except ambulatory surgery, which has a gap of 2 of the indicators. They are improving. They didn't start out that way at the beginning of the year, so making nice strides forward, and I think overall we're very pleased with the results. Moving on to our people columns, we start with our SMH corporate volunteers assisting our summer food drive, and so a group of Sarasota Memorial corporate volunteers spent a recent Saturday morning at All Face Food Bank sorting donations from the annual letters carrier drive and packing meals. At the end of the morning, the SMH crew helped pack 2,865 meals. Approximately 116,000 pounds of food was collected during the drive, which will help provide food for all of our community through the summer months. All Faiths Food Bank distributes 8 million pounds of food per year throughout Sarasota and DeSoto County. So thank you to all of our volunteers who came out. Back to School Drive was also a big success. As another school year begins, SMH employees have once again supported Mothers Helping Mothers by generously donating 155 backpacks and 90 boxes and bags of supplies. Many thanks to all the departments who participated there, and you can see some of the pictures from that. This is one we had at last month's board meeting, and just thought we'd do another recognize him. Was the family of the late Henry Speck presented a check of $140,000 to Sarasota Memorial Hospital and Sarasota Memorial Healthcare Foundation last month. But before retiring in 1990, Dr. Speck served 35 years as a member of Sarasota Memorial's medical staff. He also served on the Sarasota County Public Hospital Board and as Chief of Staff during that time. He passed away peacefully on June 15th at the age of 90 years old. The gift from the Dr. and Mrs. Speck Charitable Trust was presented by their son, Stephen Speck, who represented his two sisters and brother as trustee of the family trust. So once again, thank you very much for the family for coming and doing that. Next, we had our SMH Benefits Fair. So last month, our Human Resources Department held a Star Wars-themed benefits fair in advance of open enrollment for 2017 health plan year. Representatives from HR and benefit vendors were available to share information and answer questions. Really just want to make sure that all of our employees who are entitled to benefits here take advantage of everything we have to offer. And so if anyone's watching this or hearing it, please make sure you fill out your benefit forms. So I'm sure this doesn't come as a surprise to anyone, but SMH earns highest five-star rating in the new hospital compare scoring system. Sarasota Memorial was one of just 2 hospitals in Florida and just 102 of 4,600 facilities to receive CMS's highest score for overall quality and safety, top 2% in the United States. And something we don't strive to earn awards, but boy, they're nice when they come. We think all the actions that go into what we do for patients each and every day culminate around that. So thank you everyone for everything. Dr. Hammond, please thank the medical staff for everything they do, and Jan, certainly the nursing staff. Now, I know the board knows this because we report on this in our committees, but we always track our social media experiences. And it was amazing. So the tremendous response around our 5-star rating by CMS is now our highest ranking post we've ever had on Facebook. Received over 1,100 likes and reactions to the post, 525 people sharing it with their friends and family, another 59 comments, and then it reached 56,000, and then total pages was over 16,000. So just pretty amazing stats that we saw on that. And I think the second was trauma, and it wasn't even close. It was off the charts. So shortly after that, we weren't aware of this one. It was coming out quite at this time either. But about the week after we saw the 5-star, we received word from U.S. News and World Report that we were recognized as a high performer. So one of only 63 hospitals nationwide to earn high performer rating in all 9 inpatient surgical procedures and chronic conditions evaluated in U.S. News World Report 2016-17 Best Hospitals. You can see the different 9 conditions there. We're a high performer, which is a top 10% in the nation for adult specialty GI and GI surgery, and highest rated in the Suncoast region and among the very highest in the state. So once again, Dr. Hammond, Jan, please thank the medical staff and the nursing staff for everything that they do. As always, we have upcoming programs. In this case, we have Advanced Orthopedic Solutions for painful joints. And we also have Advanced Orthopedics Solutions for Painful Joints for Fall 2016. The free lecture series, I know you probably can't read these, but they are on our website. We just encourage everyone to go in and participate with this, and we have really some amazingly skilled surgeons that come out and do this and give their time for that. We also have upcoming programs for pain management, and so once again on the website you can see where those are. And in Health Connections, we have a number of different lections that go on there as well, once again on the website to take a look at. Other upcoming things that we have, we always sponsor Step Up to the 2016 Heart Walk. So we would encourage you to go into our website, which is www.heartwalk.org. Donate $25, get a T-shirt, and walk with the team. You see on the very disturbing picture on the right-hand side of two of our heart surgeons, Dr. Sell and Dr. Hoffberger, who are being great sports and helping us raise money around this as well. Oh, I guess there's one down at the bottom, too. That's even more disturbing. A couple of updates on construction. We have a number of facilities that are ongoing right now. Our rehab pavilion, which I'm sure as everybody has seen over on Arlington and close to Osprey, we are due to have that open in the month of December. The guys are working around the clock, and really it's going to be an amazing facility, ultimately 54 beds, inpatient beds, that is going to be really one of the top-notch rehab hospitals in the nation. And we'll be moving out of the 9 and 10 East Tower and into that facility, and then going back in and refurbing 9 and 10 East Tower and getting ready for our season that's coming up. Our urgent care at St. Armand's, we expect to have the certificate of occupancy by October 1st. We're on track for that, and we'll be seeing patients during the month of October in that facility as well. We recently announced a joint venture with Johns Hopkins All Children's and Sarasota Memorial to open a clinic in Northport. We're looking forward to that. We are trying to fast track that and have construction start on that facility, which will be on the second floor of our Toledo Blade freestanding ER, and hopefully opening in February of 2017, so just around the corner. And then finally, our Newtown internal medicine practice, which is in partnership with our new GME, our graduate medical program for internal residency, that is going to open in Newtown. Per when our new graduate students will be here, since they'll be here in July, that needs to be open in June. I would tell you, second week of June. Dr. Hammond would probably tell me earlier than that. So we are moving forward very quickly and excited about having that facility come online too. And that is the end of my report, and unless you have any questions.
Okay. Thank you, David, very much. I don't think we have any items on the consent agenda. Karen, public comment. Do we have any other business? Thank you very much.